Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, our state has 31,966 confirmed cases, 659 people are in the hospital, and 960 people have died from COVID-19. I want to thank you for joining me for the National Day of Mourning on Monday, and we continue to pray for those who have lost loved ones to this virus. Before the murder of George Floyd, and before the country heard yet again the cries for racial equity and justice, we already knew that COVID-19 was disproportionately impacting communities of color. In North Carolina, African Americans make up approximately 22% of the population, but as of June 1st, they account for 30% of the confirmed COVID-19 cases and 34% of COVID-19 deaths. Latinx people are just 10% of the population, yet they make up 39% of COVID-19 confirmed cases. These statistics are alarming, and they are not acceptable. I want to be clear that there is nothing inherent to black or brown people that makes them more susceptible to severe COVID-19 illness. The data should not be used to further racism or fear. The disparities because people of color have historically had less access to health care, housing, economic opportunity, and more. This virus is exploiting those inequalities, and it's up to us to do something about it. So today, I'm proud to have signed Executive Order 143 to address disparities in communities of color that are being highlighted and intensified by this pandemic. This order moves our state forward in several areas. First, it creates the Andrea Harris Social, Economic, Environmental, and Health Equity Task Force to address these long-term disparities. My friend Andrea Harris dedicated her life to eliminating disparities in North Carolina. She fought for social, economic, and racial equity. We lost Andrea a few weeks ago, and our state will miss her advocacy and her action. Naming this task force in her honor is a way to carry on her mission. The task force will focus on 5 areas: access to health care, patient engagement in health care settings, economic opportunities in business development and employment, environmental justice and inclusion, and education. Our Department of Administration Secretary, Michelle Sanders, will lead the group. Secretary Sanders is a strong leader, an accomplished businesswoman, and a fierce advocate for all of North Carolina. I'm excited she's going to take this on, and we'll hear from her in just a minute. In the coming weeks, we'll name a diverse panel of experts from each of the 5 focus areas, as well as community and state agency leaders to serve on this task force. As the task force examines long-term opportunities, there's some meaningful things we can do right now to lessen disparities. We know that black and minority-owned businesses are often overlooked and under-resourced. Too many of these businesses have been excluded from COVID-19 funds. My order directs the North Carolina Pandemic Recovery Office to ensure that COVID-19 relief funds are fairly distributed. It also expands the capacity of our North Carolina historically underutilized business office to provide those businesses access to opportunities and resources. We know that minority and marginalized communities are more likely to suffer from chronic health conditions, including diabetes, kidney disease, obesity, and asthma. The data shows that these underlying health conditions significantly increase a person's risk for severe COVID-19 infection. In an effort to ensure that all communities have access to health care, my order directs the North Carolina Department of Health and Human Services, in partnership with community health centers, local health departments, rural health centers, and free and charitable clinics, to provide COVID-19 testing and related health care to uninsured North Carolina, people who are uninsured in our state. Now, ultimately, we know the best thing we can do to improve health care for everyone in our state is to expand Medicaid. North Carolina should have done this years ago, and I'll keep fighting to close the health care coverage gap. Going to a doctor should not be a luxury, whether or not there's a pandemic. The order also provides direction for other state agencies. Now, I know that those marching and protesting right now are lifting up their voices for more than just health disparities. We hear you, and there's more to come. Today, we're taking steps to help reverse the impacts of long-standing inequality made worse by this pandemic. My administration is committed to helping to eliminate these disparities. We will keep listening. We will continue to work with communities all across our state to address systemic injustice. And now I'd like to ask our Secretary of Administration, Michelle Sanders, to share some remarks with us. Michelle?
Thank you, Governor, and thank you for your continued leadership during these unprecedented times and challenging times. While we have been laying the foundation for this new task force for some time, the work we officially began today with the announcement of Executive Order 143 couldn't be more timely. I am deeply honored for the opportunity to chair this new task force, the Andrea Harris Social, Environmental, and Health Equity Task Force, named in the honor of one of our great African-American civil rights, environmental, and social justice leaders, Mrs. Andrea Harris. As the governor said, she was a champion for racial and social equity and justice for all people, and worked tirelessly and fearlessly to eliminate health and economic disparities across this great state. I know that she will be with us in spirit, and I know that as we pick up the torch in her honor to grapple with these complex and critical issues for North Carolina, that together we will do well. I will chair this new task force with courage, inclusion, and hope for putting forward evidence-based and data-driven recommendations with tangible results. Addressing disparities in health and health care is important not only from an equity standpoint, but also for improving the health more broadly by achieving improvements in overall quality of care and population health. As a unified state, I know that we can get through these difficult times together. However, we also must acknowledge the systemic inequities that class, race, gender, and other social determinants present. We are not all faced with the same challenges and must look to provide alternative solutions to mitigate the impact of COVID-19 and other economic, health, and equity issues on vulnerable populations. The onslaught of COVID-19 and the resulting economic downturn has disproportionately hurt our communities of color, particularly our Black communities. You heard the governor mention that as June 1st, African Americans make up 22% of North Carolina's population, but account for 30% of confirmed COVID-19 and 34% of COVID-19 deaths in cases where race is known. And 90% of our historically underutilized businesses, which represent 58% of North Carolina's small business community, report that they have been impacted by COVID-19. The task force will work with various subject matter experts to identify best practices for creating economic stability, eliminating health disparities, and achieving environmental justice for communities of color. As mentioned by the governor, we will focus on issues relating to access to health care, patient engagement in health care settings, economic opportunities in business development and employment, environmental justice and inclusion, and education. We will focus on the root cause of these issues. The root cause of health inequity began with historical and contemporary inequities that have been shaped by institutional and societal structures, policies, and norms in the United States. These deeply rooted inequities have shaped inequitable experiences of the social and other determinants of health: education, income and wealth, employment, health systems, services, housing, the physical environment, transportation, and the social environment and public safety. Health inequities are a result of more than individual choices or random occurrence. They are the result of ongoing interplay of inequitable structures, policies, and norms that shape the lives. These structures and policies and norms, such as segregation, redlining, and foreclosure, and implicit bias, play out on the terrain of social, economic, and environmental, as well as cultural determinants of health. I look forward to working and collaborating with state leaders and the Department of Health and Human Services, the Office of Environmental Quality, the Office of Minority Health and Health Disparities, the Pandemic Recovery Office, members of the Commission on Indian Affairs, the Commission on Inclusion, the Hispanic Latino Council, and the Council for Women Advisory Board, as well as partners and experts and stakeholders across the state of North Carolina in addressing these issues for more equitable and unified North Carolina for all people. And as President Obama said, change isn't easy, but it is always possible. And we are going to work to achieve that possibility for the state of North Carolina. Thank you.
Thank you, Secretary Sanders. Here today we also have Dr. Cardra Burns, the Senior Deputy Director of the Division of Public Health, to announce some new tools that we're engaging in our fight against COVID-19. Dr. Burns, we welcome you today.
Thank you, Governor and Secretary Sanders, for your leadership. In almost every health measure, communities of color fare worse. COVID-19 didn't create these disparities, but it made them acutely visible for all to see. The root causes are complex, interconnected, and rooted in structural racism, implicit bias, and historical inequities. This is no longer acceptable, and the question is, what will we do? I can proudly say a lot. Embedded in all of our COVID-19 response is the goal of achieving health equity by investing in and directing a disproportionate amount of resources to historically marginalized populations. One way we are doing that is beginning with ensuring that we break down barriers to access for testing. The new initiatives that I'm announcing today are a part of a larger effort to make sure that COVID-19 testing is available in trusted and accessible places for communities of color. Today, we are launching 2 new online tools to help people determine if they may need to be tested and find a nearby testing place. Many people may feel uncertain or confused about whether they should get tested. While there is no substitute for a conversation with a medical professional, our new online tool called Check My Symptoms allows people to enter their symptoms to determine if they should get tested for COVID-19. Find My Testing Place is a resource for anyone who needs to be tested for COVID-19 but aren't sure where to go. People can enter their county or zip code to find a testing site. These new online tools and resources will help North Carolinians have the information and support they need to protect themselves and their loved ones. Before I conclude, I can't talk about testing without acknowledging my co-lead, Dr. Scott Schoen, the Test Surge Work Group, and noting that today we reported our highest number of tests completed at more than 19,000. I am so appreciative of our local health departments, federally qualified health centers, hospitals, health systems, private providers, commercial labs, community partners, and so many others who are ensuring that testing is widely available and who are intentionally focusing on our communities of color who are disproportionately impacted by COVID-19. And of course, everyone should practice the 3 W's when they leave home. Wear a face covering, wait 6 feet apart, and wash your hands often. Success depends on all of us working together to protect ourselves, our loved ones, and our neighbors. Thank you.
Thank you, Dr. Burns, and thank you, Dr. Schoen, too, and the Test Surge Work Group. Having reported more than 18,000 tests conducted in one day is pretty impressive, so I appreciate that. This is an important effort to boost our testing and tracing, and these are critical pieces as we fight this virus. I also want to briefly mention and thank our dedicated men and women operating our 211 resource assistance phone line. They've marked 50,000 calls processed since the start of this pandemic, helping people get connected with community and social service resources. We applaud your efforts, and we are really grateful for them. Today we have with us our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Dr. Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Brian Tipton and Karen Magoon are our sign language interpreters, and Jackie and Jasmine Mativier are our Spanish language interpreters. Really go to that website, you can put in your symptoms, you can find out whether you should have a COVID-19 test, then the site will tell you where you go to get that test. It's a good tool to have, and I'm glad we're rolling that out today along with the executive order. We're now going to take questions from the media. If you can identify yourself and your organization, we would appreciate it, and we will take the first question.
Our first question will be from Rose Hoban with North Carolina Health News.
Rose, are you there?
I think we're getting that one.
Okay, we'll take our next question from Gary Robertson with the Associated Press.
Hi, Governor. Just slightly off topic, but still on COVID-19. You have a bill on your desk that would allow bars to reopen outdoors. You need to act on that by this weekend. What are your plans with that bill, and what do you think about a similar bill that would reopen gyms despite your executive order that still has them shuttered? Thank you.
Thanks. I have concerns about both of those bills because they take away flexibility during the time of emergency. We've said all along that we really want to boost the economy and to ease restrictions at the right time. And we're looking at this data, our indicators, our trends, putting it all together and making decisions. And now we're in phase 2. Restaurants have been allowed to open. Personal care services have been allowed to open. We're analyzing whether bars and gyms should be able to open. And I will say there's a possibility that even before we get to the timeline of phase 3, that we might want to do a phase 2.5 or look at some of these additional items that might boost our economy, but that we would feel safe about not boosting the number of COVID-19 cases enough to overwhelm our hospitals. And that's something that we're considering. But the real problem with this legislation is that if, for example, we do have a surge in beds, then the authority of the executive branch is taken away to be able to close those again in order to protect the health and safety of the public. And the General Assembly would have to go back in and pass a law. That defeats the purpose of the Emergency Act, allowing the executive branch to take specific action in an emergency, and it removes the flexibility. It also hampers the ability of local governments to go in and make those decisions to protect the health and safety of the people. So although these things may be good to do at some point in the near future, this legislation is not the right way to go about it. We're reviewing both pieces of legislation. I don't think one of them has passed, but we'll let you know as soon as we make a final decision on it. Thanks. Next question.
Michael Hyland with CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. I wanted to ask, we're getting very close to 1 million people filing for unemployment in North Carolina since the COVID-19 outbreak began. Aside from changing who's in charge at the Division of Employment Security, what specifically have you asked them to do differently, and how are you ensuring those changes actually happen? In addition, what do you have to say to the more than 300,000 people still waiting for their benefits? Thank you.
Well, one of the things that I've asked them to do is significantly improve customer service. Unemployment laws are getting more and more complicated because there are more benefits that intersect. And in a division that was handling 12,000 claims a month, not only are they handling many more claims, of that over 1 million claims, but also intersecting claims with both federal and state claims. I've issued an executive order to take away some of the regulations to make it easier for them, which is positive. They don't have to have an in-person meeting. They don't have to be putting in applications for a job. The employer doesn't have to pay for it. Those things were all in the law by executive order. I've taken them out, and the General Assembly has since confirmed that. They're getting more and more people trained to be able to answer the phone, and also they have installed a new chat function. And I think today we're trying to confirm this because I look at the numbers coming from Division of Employment Security every single day, because I know each one of those numbers represents a family on the edge and someone who needs unemployment benefits. It looks like that all of the unique callers, sometimes people make 2 or 3 calls, but the unique callers, all of them got to somebody today, which I've asked them to find a way to make sure that you answer every single call. There are some people who have complicated issues that they're working through, having to deal with. They put together a team of people who can go in and analyze all of these complicated issues. We're now getting close to 700,000 people who are receiving unemployment benefits. I think the number, I have to go back and look, I think the number is over $3 billion of money that has gone out to North Carolinians. They are still striving and working hard every day to get more money out to more people. With the extended number of people that they put in place, with the number of people that they're getting trained to answer the phone, with the additional chat function, with the teams they put together to go through to handle the more complex cases, they are making progress. We're pushing them every single day. They're working hard. Thanks. Next question.
Eric Spanberg with the Charlotte Business Journal.
Hey, Governor, this is Eric Spanberg at the Charlotte Business Journal. I wanted to ask you 2 questions about the RNC here in Charlotte. The first is whether you see any kind of drop-dead date in terms of making a decision on whether this goes forward or not. I know that's not your decision, but, you know, having a resolution to it. And then secondly, I want to know what your perspective is on the RNC offering a version of the convention that would put all of the events or most of the events here other than the nominating speech or acceptance speech by President Trump.
Let's make one thing clear that I've said all along, that I've said to the President personally, that I've said to the RNC, that we put in writing. We want the RNC convention in North Carolina. We want to make sure that it is held in a safe way to protect the health of North Carolinians. I was told by the President that he insisted on a full arena, 19,000 people inside the Spectrum Arena with no masks, with no social distancing, and that we, the state of North Carolina, had to guarantee that they could do that at the end of August. We said, we want the convention here. We're willing to work with you on outside venues. We're willing to try to find a way that you can safely do it, but we cannot guarantee that. There's been discussion about having all of the other events in Charlotte except for the acceptance speech that the president has insisted upon making sure that there's an absolutely full arena with no social distancing and no masks. I hope that that can come about, and I understand that some of those discussions are occurring. So we want the convention here. We think it's good for North Carolina. We're not going to guarantee something that we know could hurt the health and the safety of North Carolinians. And, you know, look forward to any continued discussions that they want to have. The president announced that he's moving the convention somewhere else. I think the RNC wants to keep a lot of it in Charlotte. We'll see how it all works out. Thanks. Next question.
David Hodges, WBTV.
Hi, Governor. How are you doing? Similar to Eric Sandberg, who just spoke regarding the RNC, my question was revolved around that. From people I've talked to, there is concern about the possibility of litigation coming out of all of this. Are there any concerns that the convention not coming to Charlotte could put people in the middle of a lawsuit, whether it's city, the state, or people who have donated money to this?
I know that there are a lot of contracts that have been entered into by a number of organizations with hotels, with restaurants, with the convention center, with the Spectrum Center. I know that there are a lot of those, and people plan this go forward. I think it's important that all of those be viewed in the context of the fact that we have declared states of emergency in Charlotte, in North Carolina, and in the United States. And we have a COVID-19 pandemic. When I talked to the president, I commended him on not having had any rallies since March because of the potential danger to the participants. So it's pretty obvious that the state of North Carolina cannot guarantee a full arena in August because we don't know what the status of the virus will be at that point, and we're continuing to make sure we don't overwhelm our hospitals. So, you know, I think there's still discussions going on. We'll have to see what happens with those contracts, but we're going to continue to keep the health and safety of North Carolinians as the #1 priority here. Thanks. Next questions.
We're going to try Rose Hoban with North Carolina Health News again. Rose, are you on the line?
I am. Thank you so much for taking my message. So, Governor, I know you're talking about the inequities that are present in COVID cases. There's also inequities in the prison and jail population, but it's very difficult for folks out here to know what's happening in the prisons and jails in North Carolina. Do you plan on letting us know what's happening with COVID in prisons and jails?
Yes. Our Department of Public and Safety can certainly provide that information. You know, there's more that we need to do with all of criminal justice. Many of these inequities have been brought to light. We mentioned several times that African Americans make up 22% of our state's population. They make up 52% of people who are in prison. Those are the kinds of things that we have to deal with head on. And I know our Chief Justice of our Supreme Court gave a speech the other day about tackling those inequities. So we look forward. There's more to come. I mentioned earlier there is more to come. There's more to come in the criminal justice arena. As for the safety of people who are in prison, right now the Department of Public Safety is in the process of testing every single staff member. Those are people who go into the community and back into the prisons, making sure that people who are in our prisons aren't infected. Testing is going on throughout the prison, and I don't know what information that you're looking for that you do not have, but if you can certainly ask our office and we can try to provide that to you. Thanks. Next question, please.
Andrea Blanford, ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. A follow-up to what you said earlier about a potential for a phase 2.5. As the protests and marches continue, you're tracking the data, I know, and whether that's having an impact on our COVID trends. Is there a point in time, say 14 days from the start of the demonstrations, when you might look back at the trends and say, if there's no drastic change, we'll consider going ahead and allowing the playgrounds, the gyms, and the bars to reopen outdoors at that point? Thank you.
The data will guide us. We will be looking at the number of hospitalizations, the number of hospital beds, ICU beds, and ventilators that we have available, the number of positive cases, the percentage of positive cases, the number of people coming to the emergency room with COVID-like symptoms. All of these things operate as canaries in the coal mine, and they operate together to give us a potential forecast of what's coming down the road. Yes, I'm concerned about people who may become infected with COVID-19 at any kind of mass gathering or meeting, including protests. And I'm going to let Dr. Cohen say a word or two about that and our encouraging of more and more people getting tested so that we can identify, isolate people, and try to slow the spread as much as we can. But Dr. Cohen?
Hi, Andrea. So yes, I think we want to continue to watch our trends, and anytime we see large groups of folks coming together, we know that there is a potential for exposure when folks aren't able to socially distant. So we really, as we roll out this new tool to say, should I get a test, we want folks that may have been at a mass gathering, whether that was a protest or somewhere else, like a speedway, to potentially think about getting tested. We want to make sure that we're identifying cases early and then identifying contacts of those folks. So again, we can isolate those and make sure that that virus isn't spreading around our community. So testing, tracing continues to be a really important component, as well as doing the important social distancing, face covering, washing your hands that keeps virus level low, right? That's our goal overall, keep the spread of the virus low so we don't overwhelm our healthcare system. So if you are participating in a protest or a mass gathering, we know a lot of folks are wearing face coverings, but not everywhere. We know folks are social distancing, but not everywhere. So we want to be sure that folks do get tested and make sure that they know that is available to them. They can use the new symptom checker as well as the tool to find a location near them. Thanks.
Thank you. Next question.
Kate Martin with Carolina Public Press.
Good afternoon, Governor. This is Kate Martin with Carolina Public Press. I have a couple of questions. When you say the state wants to provide COVID-19 testing and related health care or health services, how much will this actually cost the patient and how will they qualify? I'm basically wanting to know, what is this going to look like for the patient? Will they have to pay anything? Will they get hospital care and their ventilator support if that's needed? Also, I'm wondering if possibly Dr. Cohen can tell us about the reliability of the tests that are being used now, both in prisons and commercially. Thank you.
I'll let Dr. Cohen respond, but we do not want cost to affect people's ability to get a test. We push private insurance companies to cover these things, and there's positive things going on there in Medicaid and Medicare. And in addition, the federal government has provided COVID-19 funds, which we have appropriated to make sure that people can get tests. So we don't want cost to be a barrier for getting people tests that they need. But I'll let Dr. Cohen comment on that and the other part of the question.
Hi, Kate. Yes, as the governor said, in terms of costs for folks, there are a number of partners that we're working with, like Walgreens, that are actually federal sites for testing, and no matter who goes to those sites, there is no cost to the patient. Other places that you may be going to, they will want to bill your insurance if you have that, if it's Medicaid, Medicare, private insurance, and if you don't, then they have the ability, as the governor mentioned, to bill towards the federal government if you are uninsured. Again, if there continues to be a gap, we have also allocated additional funding from the state level to make sure we're not only paying for the tests themselves, but the infrastructure of actually administering these testing sites. So that is the work that's ongoing. Obviously, we want to maximize all of the potential sources for payment from the federal government first before we think about needing to use funds here at the state. So the team's working hard on that. But testing and the cost of testing is a real issue, and I know that more work is being done at the federal level to think about how we support the cost of testing going forward. And your second question now was, the reliability of the test. Yes, thank you. So the testing largely that is being done at many of these testing sites is what we call PCR testing. It's looking for the actual virus. It is a test that when you do a nasal swab or a nasal pharyngeal swab, sort of in the back of your throat, it gets sent off to a lab. It takes about 24 to 48 hours to come back in terms of a result. That has a very high level of sensitivity and specificity. That's sort of the gold standard, if you will. But we know that even how you take the test, like how you collect the sample, matters to how good that test is. We know if you can get a sample from way back in the back of their nose and throat, that actually is more likely for you to pick up more virus than if you're just at the tip of the nose. So there are changes to how these tests run just by the way you collect the samples. So that's generally how most folks are testing. There are some more rapid tests that are out there. Abbott had a rapid test. There have been some concerns about its ability to actually find virus quickly. So I think that science is still evolving in terms of how can we identify tests. But the majority of what the testing is right now and the testing capacity that we have built is doing that sort of gold standard PCR testing. But just know that there are still false negatives where they might say you're negative. It's possible to still be a false negative. Again, that could be because of the way the sample is collected themselves or the way the sample is run. That's just a reality of how these tests get done. But generally, we are looking at that gold standard test, and I know the scientific community is working hard on increasing the kinds of tests that can be done to make them faster, to be able to scale to more places, and still be able to identify COVID-19. But that science is still evolving. Thanks.
Thank you. Next question, please.
Richard Craver with the Winston-Salem Journal.
Governor, the question I was going to ask has been asked, so I'm fine.
Great. Next question.
Our last question will be from Dawn Vaughn with the News and Observer.
Hi, this is Dawn with the NNO. You've answered some of my questions, but I have new ones. You talked about phase 2.5, if we're at June 4th, and then phase 3 could be the end of the month, and with whether or not to sign or veto or just let the bar bill happen this weekend. What is phase 2.5? Is that next week or the following week, and would include bars or some changes to the order? What are you thinking about that?
We're going to let the science and the data drive decisions here, and Dr. Cohen and her team are looking at these numbers every day, and you don't want to be so affected by numbers on one day, but you want to look at a trend over a period of time. And when they get to the point when they feel comfortable being able to turn that dimmer switch up just a little bit, then that's when we may potentially issue new executive orders allowing more activity to occur. Remember, most businesses are open. People are doing things to slow the spread. We appreciate that very much. Businesses are taking courses to make sure that they are protecting their customers. So more and more positive things are happening out there. The problem with the legislation is that it limits the authority under the Emergency Powers Act and would prevent us from making a decision to turn the dimmer switch back down. Suppose there was a massive surge of virus that began to overwhelm our healthcare system. I think most people would want us to take steps to slow the spread of the virus, and the way this legislation is written, that ability is taken away from the executive branch under this or any other emergency that might occur. That's not good legislation, and we have a problem with that. It's not to say that the things that are in that legislation aren't laudable goals and might be potentially put into an executive order if the numbers are right. And we look forward to continuing to consult the healthcare experts, consult the business community about when the decision is made, how things are done to ease restrictions so that people can get back open again or open more than they are. We want to get this economy boosted. It is important. Health and safety of North Carolinians has to remain the priority. Thank you all very much, and we'll see you again soon. Stay safe, everybody.